Gotta love Zoom.
Samson, it's great to be with you today. Excited to introduce Samson, who's a CEO and co-founder of HealthSnap. Let's start with some introductions. Tell us more about you. Tell us about how you started this company. What was the vision behind it?
Yeah, well, thank you for having me, Sonia. It's an honor to be here. So my name is Samson. I'm one of the co-founders and the CEO of HealthSnap. We started the company in 2015, and for me, it was out of personal need. We saw a very large gap in the way that chronic diseases were managed, and we realized that we're trying to treat a chronic problem acutely in a physical brick and mortar clinic with medicine, as opposed to at the root cause, which is in lifestyle and behavioral and more proactive and preventive measures in the context of daily life. For me, I was set on going to medical school. That was my lifelong dream. I was pre-med. I even took my MCAT. And the
Yeah.
year I was set to go to medical school, my grandfather unfortunately passed away. And he
Mm,
had multiple chronic conditions his entire life. He actually had a heart attack in his 40s, which is very young. He was diagnosed with type 2 diabetes in his 60s. He had
mm.
another heart attack in his 70s. And every time he had one of these life events, he was literally given a piece of paper, a new medicine, and told basically, good luck, and we'll see you at your next checkup. And what that led to was me seeing how our healthcare system is not designed for chronic disease management, and it's not designed for proactive and personalized care between office visits. And so that was the
Yeah.
gap that we identified. We understood that there's a rapidly aging and chronically ill population, and that my grandfather's story, which led to me starting the company, is not unique. It's actually the norm. And that's a major problem that we're trying to solve.
That's I'm always so inspired by leaders and founders who sort of use that personal story to solve a bigger problem. So yes, I think each of us probably can identify with an issue like that with either ourselves or somebody in our lives. So as you look at the bigger problem space that HealthSnap is specifically looking to solve, tell us more about what are the big problems, what are the big rocks you're trying to move? What are the big problems you're trying to solve? And why are they important now?
Yeah. So just going back to my point around a rapidly chronically ill and aging
Yeah.
population, I always use the same statistics because they're really powerful, and everyone, I think, is always a little surprised to hear this. We have 4 million people a year that are becoming Medicare aged right now.
Yeah.
68% of those 4 million people have two or more chronic conditions. 36% have four or more, which is leading to 90% of all of our healthcare expenditures. So we're not doing a very good job at managing chronic diseases, at
Hmm.
preventing them in the first place, and even managing them accordingly to prevent the high utilization that they're causing right now in our industry. So that's number one, is that there's a major chronic disease like epidemic in our country. And it's rooted in the foods we eat, the habits that we have, the access to care. Number two is that we have a major staffing challenge. You talk to any health system, and that's probably number one or two of their
It
priorities, is
is.
that we
Yep.
literally don't have the ability to service our populations. There's such a high demand for healthcare services that we just can't support it and staff it. And that leads to access problems, which leads to higher utilization and lower outcomes as well. And so access, I think, is the second one. And the third is just being able to provide people with personalized care specifically for their conditions, and how to coordinate that care more effectively and more appropriately. And we hit on all three of those, where we're supporting care in the home through personalized care plans and pathways, and supporting virtual care management programs at the point of care delivery, which is through the health system or providers directly.
So interesting. And yes, I think that personalization challenge is a huge challenge. It's healthcare right now in the US is still largely a one size fits all for most people, and that just doesn't work in terms of um, outcomes and tailoring and the engagement you want from people to be involved in their health. And yes, the staffing challenges. Every health system we work with, that is one of the top three things they're tackling. So how does HealthSnap solve these problems? Tell us specifically about your solution.
Yeah, absolutely. So we have three components of our solution that all work hand in hand together. Number one is our virtual care management platform. One of the
Okay.
key differentiators for the platform is that it's condition agnostic, meaning we support all of the major chronic conditions across primary and multi-specialty care. And within that platform, it allows the analysis of remote patient data. So if we're
Mm,
gathering blood pressure readings or glucose readings or weight readings, we're actually able to provide that personalized care plan and care pathway to ensure that the patient is getting the right care at the right time and in the right location based on the conditions that we're monitoring and managing. The second aspect of our solution is our connected device ecosystem. So we work mainly with Medicare populations. Medicare
Okay.
populations are typically low tech literate. And so you have to solve for that population very differently. And so all of our devices are pre-configured, they're cellular enabled. And so when we actually send the device to the patient's home, we do all the shipping and logistics, that device is already paired. And all they have to do is just take it out of the box, start using it, and it transmits to the cellular network. So for a low tech literate population, they can use it very easily. And for patients that are in underserved populations, they don't need a smartphone and they don't need Wi-Fi to participate in our programs. The third piece of the offering comes back to the staffing challenge. We provide clinical staff members, so licensed professional nurses and registered nurses that
Okay.
work under the supervision of the customers that we work with, which are the healthcare providers. And those individuals are responsible for monitoring and managing patients remotely, for coordinating care, and ensuring that patients adhere to their care plans, their medication regimens, and are getting that care coordination they need at the appropriate times. And when you put all those together and you integrate everything into the medical record, now you have a really scalable approach to personalized virtual care management, and it allows a health system or a provider group to unlock true population health at scale. And that's what we've been able to achieve nationally.
Very interesting. So connected devices, your own clinical staff. Is it largely your clinical staff managing these populations, or is it in concert with the health system providers as well?
Yeah, it's in concert. I think for a health system, if you're listening to this conversation, think of us as you just hired a team of care coordinators under your supervision. We act as an extension of our partners, and everything is fully white labeled. So when we work
Okay.
with our health systems, our nurses are introducing themselves as I'm working with Dr. Jones from ABC Health System. And so that brand recognition, the trust and credibility, the rapport building is all built into our service offerings.
Super helpful. And say more about the personalized piece. Is that just through the devices that are being sent? So it's real time patient data that is used to personalize the experience?
It's a mix of multiple things. So it is coming from the devices where we're getting blood pressure readings, and then we have algorithms that analyze those trends over time and give insights or trends of readings that are out of range or not out of range. But we also look at things like social determinants of health, preventive care gaps. We look
Okay.
at dietary strategies. So we actually do nutrition surveys. We look at activities and exercise habits, and we actually generate a comprehensive lifestyle profile for a patient, and it has all of your RPM, remote monitoring physiological data, plus your lifestyle, behavioral, and clinical data in one profile. And we risk stratify every patient and whether they're trending up or down. And again, that goes back to more than just monitoring a blood pressure reading, but actually managing that patient's health over the continuum of their care journey to ensure that we're providing that personalized care when they need it most.
Well, that is really interesting. So one, how are you getting a lot of these sources of data? It's not always easy to get that level of information about a person. And then two, you have examples of how you might use this data to provide specific lifestyle-based interventions or guidance in that
Yeah.
journey?
Yep, absolutely. So we take a multi-channel approach in terms of how we gather the data. So we have a device ecosystem where you can actually integrate through our mobile application,
Mhm.
third-party wearables, connected health apps, so like Apple Health or Google Fit if you're on Android. So we integrate all that data in the first place. Then we analyze all of it in our lifestyle profile and risk stratification. And then patients are getting personalized education and resources based on that data in real
Okay.
time. And the nurses are actually working with those patients as that data changes as well. And so, for example, if your blood pressure now is starting to trend upwards, they'll get a notification say, hey, we notice your blood pressure is actually trending up, 12 points in the last 30 days. Here's a resource on the DASH diet and education around how to lower your blood pressure through dietary changes and strategies. So we'll take the real-time data to incorporate it into our actual care plans and pathways for that patient interaction.
Got it. So the care coordinators are getting prompted with those real-time personalized interventions or advice that may be needed to push that out to those patients as well.
Exactly. And that informs all of our clinical communications.
Are there certain specific types of chronic diseases you're focusing on, or many of them, or where are you starting mostly?
Yeah, so our platform supports 40 plus chronic diseases. So we have all the major ones. I would say the core use cases that we tend to see, at least for systems that are just starting a remote monitoring or chronic care management or principal care management program, fall under uncontrolled hypertension management, congestive heart failure, obesity management, uncontrolled type 2 diabetes, COPD, asthma. Those are typically the ones that we see, and then a myriad of other conditions that usually are comorbidities associated with those as well.
Yeah, that's helpful. Knowing that this is a fairly crowded space, how would you say HealthSnap is different? Like, what would you want a health system to know about the differentiators? I know you've talked a little bit about the clinical staff support and the personalization piece. Is there more to the differentiation that a health system should know about?
Yeah, so we think of this in a couple ways. First off, I think a lot of health systems are dealing with vendor fatigue and point solution
Mhm.
fatigue. And
Yeah.
so that's a common theme when we talk to systems. They might have an existing program in place or three or four or five, but they never scale and they don't integrate to Epic or Cerner or Athena or whatever EHR they're on in a way that is embedded into the clinical workflow to actually get the
Mhm.
change management and adoption by the providers who are the users at the end of the day. And so, number one, we're a condition agnostic enterprise platform, and I think that consolidation effort that health systems are going under now is one of our differentiators. Number
Mhm.
two is just our proven ability to scale. We have
Okay.
15 plus health systems that have 20 to 30,000 patients enrolled in our programs. And we just don't see that elsewhere. Most programs are having trouble scaling beyond 500, 1,000 patients. That is tied to one of our main differentiators, which is our EHR integration. We're not just sending, a PDF or a media file to a media tab and expecting a provider to look at that. Everything is actually encounter based, and we're just sending discrete notes and discrete readings into flow sheet rows and notes. And we have a patent on our ability to automate the revenue cycle. So for any of the revenue cycle teams that have tried to bill for RPM or CCM services, it's a major challenge to look at an Excel file and try to manually key in charges. We automate all of that, and we have a patented way of doing that so that we can actually create real scale and impact for these programs on the financial ROI side, without them having to manually do the work behind the scenes. And our partners find that to be a really big differentiator in the way we integrate into the EHRs as well.
Yeah, it's so critical. I think where a lot of solutions fail or don't get out of pilot is if they're not fully integrated into the existing workflow. You spoke about ROI. Tell us a little bit about metrics, impact, KPIs you're seeing. Where do you see the biggest impact? Can you share any specific examples?
Yeah, so I'm a firm believer that clinical ROI leads to financial ROI. There are
Mhm.
so many companies in our space that say, "Oh, here are CPT codes. You can make
Right,
all this money now on these programs because of these CPT."
right.
And I think that's a really misguided way of thinking about these programs because you only are able to do that by providing value and actually delivering the services that a patient receives value from to be able to get that payment. And so we're really proud of our ability to one, drive the fact that for like CMS, for example, they require 16 days of data in a 30-day period for RPM. It's a high threshold and bar. Not a lot of companies adhere to that,
Yeah.
but that is a requirement by CMS and Medicare to actually bill for RPM services, for example. 86% of our patients achieve that in a given month. And so
Mm.
that's a point that we're really proud of, that we have a highly engaged and compliant
Wow.
population. That's a
Right.
testament to our nurses and the relationships they build with patients to
Thank you.
make them adhere to the regimen of wake up, you take your blood pressure, then you have your medication, you take your blood pressure, then you have your coffee, and those frequency and protocols. So that's number one. Number
Yeah.
two, our partners and our business model is designed to be pay for performance. So we
Mm.
don't charge anything up front, and we only charge if those services are rendered in a way that allows the program to be profitable. So we do think that's highly
That is
differentiated.
that is a
Um,
differentiator. Yeah.
there's no risk up front for our partner to work with us, and we ensure the success of the program, that when you win, we win. And again, that's all rooted in our clinical engagement. And then lastly, we have peer-reviewed publications and journals that we have. We're demonstrating 21-point reductions in systolic blood pressure, almost 60 point point reductions in fasted glucose readings for patients with uncontrolled stage 2 hyperglycemia, marked unprecedented results that some of our chief clinical officer partners actually don't believe until they look at the data themselves. And we're really proud of our ability to have peer-reviewed publications and partners that come with us to be able to demonstrate the efficacy of these programs.
Super helpful. I love the way you describe the different levers of ROI and the specific examples you shared. I think that is so important for health systems to realize, and your pay for performance model too. This has been great, understanding more about your solution, why it's different, and how you work with health systems. Anything else you'd like to share before we close our time?
Yeah, ultimately, I think that we feel like the gold standard of chronic disease management will be
Sure.
care that's always on, and it's not an either or. And I think a lot of health systems are fearful about that change management of, oh, well, I've been practicing medicine in the clinic this way for so long, my patients are fine. But then we find out that they're still very uncontrolled after being medically managed, and that this is actually leading to medicinal improvements in patient outcomes. And that's something that we really pride ourselves on showing the clinical efficacy and the sustainability of these programs long term. And I think health systems that are not delivering these programs and helping patients manage their health and care in the home are going to have a tough time maintaining those patients long term, because they're going to go to systems that are doing that and providing that personalized care.
Absolutely. Thank you for sharing that. That was a great note to close on. Samson, thanks again for your time and sharing more about HealthSnap. If you want to learn more about HealthSnap, come to Avia Marketplace, but also reach out directly to the team at HealthSnap. Thanks for being with us.